anyway, I'm really excited to be here on this panel. And I'm going to kind of get us started off and do a little bit of an overview and dive into some environmental factors. And then Dr. Stage and Dr. Alschuler will move into their part. And then we're going to have a lot of time for questions and answers. These are the 4 approved medications. Contrave is sort of the newest one. And as you can see, it's a combination of 2 medications. It's bupropion, which is the generic for Wellbutrin, and naltrexone in a smaller dose than what's used for addiction and recovery, but a little bit higher dose than what's compounded for some of the conditions that we use low dose naltrexone for. And then there's chemicals. And this is the part that I want to focus on the rest of my time, and really encourage you to please screen your patients for exposure from food, air, water, plastics, personal care products. And some of these chemicals are referred to as obesogens, meaning they can actually cause weight gain by interfering with hormone function, cell signaling. They can alter your metabolism and thyroid function, contribute to PCOS. Some of those conditions that I said earlier cause weight gain.
And so I'm going to add to what Dr. Marchese has shared with a focus on the microbiome and the role that that plays in the increase that we see in obesity in the last 100 years. What can we do? First of all, I think it's really important to frame dietary interventions instead of just talking about a diet for weight loss, which can really be triggering for people and can cause people to do all kinds of things like aggressive dieting, food restriction, that often aren't really promoting health.
So insulin resistance, it's not just that it's a consequence of, but actually there's some data. There's really not as much data on this if you're looking at this issue in the literature, but there is some thought that being insulin resistant can actually promote or even cause obesity initially. And that's especially true when the insulin resistance is in the muscle. So as we know, muscle is probably one of the biggest metabolically active tissues, uses a huge amount of glucose. And when muscle becomes insulin resistant, either because of the microbiome or perhaps toxin bioaccumulation or other inherited characteristics or being sedentary, then we run into problems because we have elevated glucose and insulin levels in circulation. Fenugreek is a very powerful herb in this regard. This again is a meta-analysis and also a randomized controlled trial. So in the meta-analysis, there were 10 trials, and when fenugreek was dosed at least a gram a day, fasting blood glucose decreased, 2-hour postprandial glucose decreased, and hemoglobin A1C decreased. So all that's looking good.